So this is the test for anterior, or this is the anterior drawer test, and it's for the anterior cruciate ligament. Remember that the anterior cruciate ligament controls anterior translation of the tibia on the femur. So very simply, I'm going to try to pull that tibia forward in this test. We want the hip and the knee to be flexed. The knee should be flexed at approximately 90 degrees, which that's going to be it right about there. We can do this test with the tibia rotated, which would be the foot pointed out or the foot pointed in. We're just going to do it for our purposes in this class. We're just going to do it in a straight plane so the toes are forward, pointed straight forward. When I pull on the tibia, there's a tendency for the knee to come out of flexion, so I'm going to sit on her foot like this. Okay? So knee flexion, hip flexion, knee flexion, and then take your fingers and curl them around the back of the leg because you're going to grab those heads of the gastroc, and that's really what you're pulling forward. Okay? Your thumbs are beside the patellar tendon sitting on the tibial plateaus, and a good indicator of whether or not you have a lot of tibial translation is how far your thumbs dig in on those plateaus. You'll feel like your thumbs are going deeper into the joint. It's not really what's happening, but that's what it feels like. Okay, so the patient is relaxed. The other purpose of putting my hands around the back of the leg is because here's the medial and the lateral hamstring tendons. And as I was saying, if your patient is in pain or has some knee swelling or has a significant knee injury, the muscles can be in spasm, they can be guarding, and when you have muscle tightness, so you feel these tendons and they're really tight, you're going to get an invalid test. You're probably going to get no motion when there actually is an injury. So I always feel those, okay, try to assess how tight they are, and of course you're telling your patient just relax. Okay. Notice that I'm resting this muscular portion of my hand, the heel of my hand, on the tibias. Okay, so my thumbs are in the joint line, my muscle belly's here, but heel of my hand on the tibial condyles. Okay, and that's what the test looks like. Usually do these in threes. Okay, and I can visualize and see how much tibial translation there is, but I can also just feel it. Okay, so it's pretty good and tight. While your patient is in this position, we can also do the posterior drawer test. So that one was anterior drawer. Posterior drawer is simply pushing the tibia backwards, and it looks like this. Okay, assessing how far it'll go back. So this would be ACL pulling this way and PCL pulling that way.